Thank you, Hayes. Thank you. Good morning, everyone.
Good morning,
Morning,
Doc.
Yeah. So
Morning, Doc.
before I will start with the orientation, I would like to ask everybody, do you have any problems as regards to our previous lab activities? Yes or no? Wala?
None naman, Doc.
None,
And,
Doc.
do you have difficulty in navigating the course site? No problem.
None naman, Doc.
None
Nasabtan
din,
naman
Doc.
ang instructions, Doc.
All right. So the course site has been opened this morning for an activity. You will have an activity this afternoon. This will prepare you also for tomorrow. So, Dr. Camelio will also upload a few pre-reading materials also, which she might find a little. If she finds that the pre-reading materials uploaded in the course site are missing, she may have some additional. Anyway, the the course site is open up to uh, unit 3 module 1 lab activity free, no? You have the pre-reading materials for all lab activities 1, 2, and 3, but you may not go through all the pre-reading materials of all 3 lab activities. So you can bite small bites lang. You start with lab activity 1 to prepare you for tomorrow. And then lab activity 2. The videos are short. They are very short. And although they are many, but they are short. These have been curated. I have gone through the videos, and they are acceptable. So they are acceptable videos for you to read. So you don't have to surf through the internet to study for those labs. We are offering it to you already, no? And as much as you cannot come to the lab and interact with us. Now, while going through the videos, if you have questions, you may use the Google Classroom laboratory lab, no? To ask a question, and then any of the faculty will be able to see your question, will be able to answer that. Or if not, you may use the Google chat box. Use the room, the anatomy room. Do not chat uh, personal, no, one-on-one, because your questions are important, and that all other members or classmates, or your classmates, will be able to see your question, because your questions might be the same questions that your classmates may have, no? So we will share. And this is a laboratory work, so you have at least 2 types of laboratory work. The independent synchronous because you do it at the same time, although independently, and I'm monitoring that, just like the surface anatomy. And for unit 3, you'll be having a team-based learning activity as well, no? But we will orient you. I think have you done already team-based learning, right?
Yes,
Yes.
Doc. We have
Yes,
that.
Doc.
Yes. All right. Okay. But okay, let me share na lang na screen. Check, check. So any questions so far, ha? Wala. Hello.
None so
Wala,
far, Doc.
wala naman, Doc.
Okay. So again, good morning. I'll just orient you how to study for gross anatomy. Okay. First and foremost, I will talk about how to study gross anatomy in general. In general, okay. Okay. So you have to make your lab sessions count. All all laboratory sessions, maximize it. No? If you have a team-based learning activity, all the bones that are given to you, you must discuss it as a group. Uh, do not just answer the items or the structures being asked of you during the team-based learning. If there is enough time, you discuss also the other important points. No? As I've said earlier, your lab sessions will be in team-based learning and independent synchronous sessions. Last year, we only had uh, team-based learning, but initially we used to do it on Zoom with PowerPoint. It was a little bit stressful for the students. Um, this time, but no, sorry, by the second bi-monthly of last year, we were able to morph it to team-based learning. So, but this year, we're trying to give you additional learning uh, activities, meaning uh, learning opportunities using the core site. You know. If you have problems with the core site, by the way, you message me, you inform me, huh? Or any of the faculty, because we will adjust it. Okay. Now, your lab sessions, again, as I've said, team-based learning and independent synchronous sessions. In your core site, we have the resources, which is growing and growing as the bi-monthly uh, uh, the year is progressing. A lot more of the uh, resources are being placed. No? Uh, Aside from the resources, you have pre-reading materials, and these pre-reading materials are usually taken, curated from the net, no? So that it will be easier for you. Now, there's just one thing that I would like to ask of everybody, especially with the resources that we're putting up, in as much as these resources have been created by most of our faculty. It's not all of our faculty. They are their own intellectual property. You may use it for your own consumption. Please do not distribute it. Do not upload it to the YouTube site. No, um, I've, I've, I have several videos placed there. Although it's in the YouTube, but it is unlisted. In other words, if anybody will search for that video, it will not be located. It will not be searched for unless you, my dear students, will copy the link and try to distribute it to everyone. Or you have your own YouTube account. You're going to upload it to your YouTube account. So my instructions for you is do not use distribute all of those any or part of the resource materials that we uploaded in the course site. Is that an agreement? Agreeable with everyone? Yes?
Yes,
Yes,
Doc.
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 All right. Okay. Thank you. So, in your team-based learning activities, you will have your independent, then you'll have your breakout rooms. No? As I've said earlier, you need to manage your time well in those breakout rooms. You discuss that your proctors will be coming in and out. If you have problems, though, you can chat through the Zoom, or if you have the uh, account of your proctors, then you also do so. For the first bi-monthly, we have the following proctors for the laboratory. Group 1, Dr. Camelio, Group 2, Dr. Rivera. Congratulations, Dr. Rivera, for being the newest medical oncologist. If you're here, I don't know if she's here. No? Give a big hand to Dr. Rivera. She just passed her oral exams, her certifying exams, so she's now a certified medical oncologist. For group 3, that will be me. Group 4, Dr. Lucero, and myself. I will just help Dr. Lucero. Kuan man siya kanang, what's that? Person with disability. False. Group 5, I'm hoping Dr. Vasquez will be back following her uh, delivery of her bouncing baby girl. Siguro to, no? Healthy baby girl. And Dr. Lou will take care of group 6. So the second bi-monthly, we will be changing groups as proctors for the laboratory. And hopefully, we will be able to do limited face-to-face in the laboratory. By then, we will orient you again on how your conduct in the laboratory will be. Okay? Because it's useless to discuss your conduct now when uh, you still don't know if you'll be able to go there. When it's not a matter of it, but when. So first, you need to visualize the structure being presented to you. What is the structure, the neighboring structures, understand the function of that, and always use the standard anatomical position in reference to your movements, planes, directions, relationships. Always the anatomical position. Uh, you must post these quick key questions. There are 7 questions that you will need to stimulate yourself to apply the basic science information to clinical practice. Okay, what are these questions? The first is uh, given the importance of a certain required function. Okay, meaning what is this function? To uh, climb the stairs. Okay, which anatomical structure provides the ability to perform that function. Okay? Let's say climbing the stairs, uh, or in contrast to walking, what is what muscle is important in climbing stairs or in sitting up from a sitting position, standing up, which is not actually required in walking. So then you'll be okay, what is that? So probably that should be the gluteus maximus. No? So you as a student, you should be able to relate the anatomical structure to the function. No? Let's say if you're in the skeletal system, then what is the function of the bone? So we have several functions of the bone. I think Dr. Camelia will tell you that in her correlate later. There are several functions of the bone, the skeletal system. That should be your first and foremost question. The second question is, given the anatomical description of the body part, what is its function? So it's the reverse now of the first question. Um, okay, let's say if you have the eyelid, for example, it's described as being uh, two muscles, no? Okay, and you'll have different functions for those two muscles. So just the orbicularis oculi uh, for, alone, no? So, ano ba function niya? One is for strong closing of the eyes, one is the winking, etc. So those are the first two questions you should ask. Then the next question is, if you have a symptom of a patient, what structure is affected? So this is a little clinical anatomy. Usually we give you history and physical examination, but when you go to clinics, you will be able to derive the answer to this if you take a very good uh, history and physical examination. In as much as you don't have the skill of history taking and physical examination yet, you will have this in second year. Any case given to you will have you will we will give you the pertinent history and the pertinent physical examination for that case. No, so this it's like if given these two important details, you will be able to see what's beneath the skin. You know? You already have an imagination. Let's say, example, a patient who has uh, uh, complaints of epigastric pain. What are the following? Which of the following organs are involved or probably involved? Okay, kidney, stomach, uh, appendix, uterus. Which you'll know the answer. So it will be the stomach, the gastric man, no? So this is how you should be able to uh, orient yourself in the study of this anatomy. Okay. Again, the next question is lymph nodes, because lymph nodes are part of the anatomy and very important when you go to clinical uh, practice, no? Especially if you're dealing with infection, if you're dealing with malignancy, lymph nodes are very important. We already have Dr. De Vera here. She's a medical oncologist and she knows, she's very well versed which lymph nodes are affecting which what region for what kind of malignancy. No? Let's say breast. You're talking about the breast, any lesions in the upper outer, upper right, upper outer, upper lower outer, or most of them will spread going to the axillary nodes. But if you're talking about upper inner quadrant of the breast, most of them will go to the mediastinal nodes. So more or less like that. No? If you're talking about the tongue, tip of the tongue, where does it go? Or side of the tongue, base of the tongue, where does it go? So these are the things that you need to. But if talking about the lymphatics, no? You should be aware of these pathways. Yes. Knowing the lesion, given a primary tumor, you will now know where to direct your physical examination first. No? Let's say the patient is complaining of tip of the tongue, then uh, you might be thinking about palpating the submental first as you progress, etc. No? Dr. De Vera is already here. Jamie, you're here.
Yes, Doc. I just
Hi,
came in.
congratulations, everybody.
Thank you, Doc.
Right. No, congratulations. Bago pa ning luto pagka medical oncologist. All right. So the other question is, if an injury occurs to one part of the body, what is the expected clinical manifestation? It's similar to the first two questions. No? Let's say you're talking about the nerves. Okay, that particular nerve, you have nerves which come from the spinal cord, then it goes to the extremity. That's a very long course. And sometimes these nerves will give off or innervate certain muscles along the way, you know. But there are also nerves that just innervate the one distal. Okay, so you need to know what is the expected deficit if that particular organ, that particular uh, nerve is injured. Let's say um, if you're talking about the stomach, okay, this is just you don't have to read about this because later on in GI tract you will know this. If you talk about the stomach, because of a malignancy, for that matter, what if you remove the entire stomach? Then what is the manifestation of the patient after surgery? Because there are several important cells that are associated or is located in the stomach when if it's in its absence will manifest as problems or symptoms to the patient. One of that is digestion. No? Digestion. So uh, when your stomach is no longer there, you approximate the small bowel to the esophagus. Well, you'll have to have a patient who will be complaining of, you know, digestive problems. She's not able to really, the main function of the stomach is to digest and more or less liquefy the solid food that you take. But your small bowel cannot do that. And, so you will have to think about uh, you'll have to think about that. Also, the stomach, if you will learn later on, has a particular cell that secretes intrinsic factor of Castle. That's very important in the absorption of a certain vitamin. That without that vitamin being absorbed, it cannot absorb. The body cannot absorb it, even if the vitamin is supposedly absorbed in the ileum part, because of the absence of intrinsic factor of Castle, it cannot be absorbed. Yapon. So without that vitamin, the patient will manifest with a certain kind of anemia. So things like those. So this is how you should study your anatomy. Then given deficit, what is the weakness? Given a weakness or deficit, what symptoms or other symptoms would the patient most likely have? No, usually it's a three-step analysis. So where is the injured? What is the probable site of the injury? And then what are the other structures in close proximity that would cause the manifestation? Okay. Uh, this is a little difficult. No? It entails higher order learning. No? Okay. Aside from this, knowing if there's a deficit, you should also be able to determine what usually compensates. Let's say uh, if you have a problem, the supraspinatus muscle, this muscle usually is the one that helps in the elevation uh, and the first 15 degrees of your upper extremity to abduct. No? With a deficit of that supraspinatus, you cannot elevate that. No? But still, the patient can abduct beyond that 15 degrees. So what usually does the patient do? He tilts, throws the arm, and then he's able to raise the hand. Uh, he just have some deficit or some weakness simply because the arm abduction is a function of the other muscles like your deltoids and your trapezius, not only with the supraspinatus. So things like those, no? Understanding that. So far, so good, everyone. Okay. The other questions that you need to be learning about, especially when you go to the reproductive system. No? The reproductive system is the female or male homologue of the organ in question. Uh, since you are in Unit 3, Skeletal System, Module 1, outright, I will also tell you that there is a difference between the uh, male and female pelvis. So with that alone, you need to learn uh, what are the differences and why is it important to know the difference between a male and female pelvis. Always the key word there is why. Why? Always why. Why do you have the like this? Okay. All right. I'll give you some examples in the practical exam, probability-based learning, or even the practical exams. There are several type of questions that you will encounter in a practical exam. So, as in this case, you're asked A and B. No? A is identify the bony feature shaded, or it may be pointed. No? And you will notice there will be two colors, no? Different colors. You will not mistake. B is blue, A is red. No? So you will know that this is the area in question. Uh, at times, you have a statement there that you should be very specific. Okay? Specific. Let's say uh, let's say you will just not say distal femur, then may have to be very specific with that, like uh, uh, the popliteal fossa uh, of the femur. So be specific man of the femur. Why is it be specific? Because you're supposed to identify the bony feature. Letter B may not be the same bone. It may not be the same bone. So we need to know if you know that feature and if you're able to identify that bone. So specific, be specific. You have to tell us what bone aside from the bony features. Uh, the other letter B is bony feature pointed. Be specific. Now, in this regard, usually the point system is if you're wrong with A, you're correct with B, you're still okay because they are not related. A and B is not related. But for another question like this, identify pointed structure, identify bone. When you say identify pointed structure, wala naman. If you notice, there's no more be specific because uh, we're trying to ask you what is the structure and then identify the bone. Now, if you're wrong with A, you're wrong with B. Even if you say this is, you will call this as the uh, you call this as the suprasternal notch, and then you say this is the sternum. Even sternum is correct, but since your A is wrong, then both A and B will be wrong. Okay? So far, so good. Questions? All right. For the gallery, there is what we call the gallery. We used to have this is a four-phase endeavor or activity, but this is usually done when you have done most of your learning or your study with that particular unit. No? Let's say in this unit one, unit 3, module 1, this is the skeletal system. You first learn what is from the textbook and what is given to you in the virtual cadavers. Look at that, master the structures, etc. Once you have done that, you can go now to the gallery walk. This time because it's online, it's no longer a walk. It's already sitting. You're just sitting. But used to be face to face, face to face. It's a gallery walk because in the laboratory we place all the normal X-rays around the laboratory where everyone will be going around taking a look at the X-rays in the normal, and then you'll be asking if you have questions, you can ask the faculty there available to ask them to. You can ask them to teach you or guide you. So that's the gallery walk. But since it's online, the gallery walk now, you'll find the resources for the gallery walk already in the resources page of the course site. So I provided you most of the what you will need for the gallery walk. And the warning here is do not go to the gallery walk if you have not gone through the your study with the anatomy from Moores to Netters, then to the resources that we given you, the virtual cadaver that we have given you. From when you have done that, you can go now to the gallery walk because if you go directly to the gallery walk without you know making a solid understanding of your uh, learning materials, you'll have a confusion and difficulty with your gallery walk. Then the gallery run is sort of a practical exam. I'm sure most of you are familiar with a practical exam in your bachelor's degree, wherein you go from one station to another station and individually. No? Let's say there are 50 stations, you have 50 students in one station. Any station, you're given only about 45 seconds. Once 45 seconds are up, you go to the next station. No? Everybody moves around like a carousel. So we call this the steeplechase exam. Steeplechase because you jump from one station to another. In the gallery run is similar now, but the thing is, it's a mixture of team-based learning because you're doing this as a group. No? If there are 5 or 6 of you in a group, you'll be given the gallery run. You'll go through each station, discuss each station, give your answers. Then you go from one station to another. We used to last year we used to do it again through Zoom and PowerPoint, but we've done it through team-based learning also, because it's much less stressful for the students. After the gallery run, there will be a plenary. Now, the plenary will be a discussion of each station. No? Who will be the discussant? One of the groups who will be chosen to present one of the stations. So once you've done with the gallery run, each group will be assigned a particular station to research on. You need to research what are the X-rays there, how is this X-ray taken, then because the station has a clinical scenario, might have also to make a small or a short research on the case just to tell us what the case is all about and what are the important anatomic pearls or uh, precepts involved in that case. Now, once you've done, while doing the plenary session, uh, a reactor group is usually chosen to give his reaction. They may contradict, they may reinforce what you have said or presented. But most importantly, we have expert panels or even the faculty. They're already experts in doing this for the past several years in doing the gallery uh, activity. The your faculty will be asking you questions and validating some of your questions, challenging some of your answers there. Then somebody or all of you should be taking note of what is transpiring during the plenary, because everything that has transpired from the gallery walk, from your preparation of the gallery walk to doing the gallery walk, the gallery run, and even the plenary, all of those experiences will be placed in a manuscript. So later on, I will post in the manuscript uh, what is the standard manuscript that you will make. No? And this manuscript is usually, uh, hold on, okay, okay, I have a class. Sorry, I have a class. All right. The manuscript is very important because this will complete what we call the learning experience of Kolb. I don't know, we have discussed this, I think mentioned it during your orientation, the learning cycle uh, given by Kolb's experiential learning. And this is where you will have to uh, reflect on what you have learned and what difficulty you've encountered during the activities. And the manuscript is also graded, and we will be posting soon the rubrics for the manuscript, as well as the guidelines of how to make the manuscript, because you'll have an abstract, you'll have a summary, you'll have your findings, discussions, and your reflection. The reflection will be as a group and individual reflections. And I will also tell you how to make the reflection. What are the more important things to reflect? I think that is all. Any questions? Additional from the faculty also, I might have missed something.
I have a question, Doc.
Hmm.
Yes, Doc. During the practical, are we allowed to use shortcuts? For example, instead of answering lateral epicondyle of the humerus, can we just make it lat epicondyle of the humerus?
Um, okay, there are standard nomenclatures. Okay, yes, you can do that. lateral, but there are also non-standard nomenclatures. Okay. In as much as your exam or your practicals will be in exemplify, okay, and if you are not sure of your standard abbreviations, okay, uh, the key is usually in a standard, no, it's full, not usually in abbreviations. So yeah, you can do that, but it will be there. It may pose a risk, no, upon checking. So we'll have to do also manual checking anyway. We also do that, but most of the key is in full, less abbreviation like R. We don't usually R, put R for right. Okay. But we will try to come up with a standard abbreviation that you can use. The problem
Okay, Doc.
is if we put up a standard nomenclature that we could use, you will be studying that again. Na malibog na pod mo. But if you already study uh, your readings, what is not the standard there, then the full the full name, you spell it out, then there will I suppose there will be no problems for you. Siguro. But yes, you can use, but it should be standard.
Okay, Doc. Thank you, Doc.
Take note of the spelling. It's very important. Spelling like ilium. Ilium has uh, we have the bone and the ilium, which is the intestine. They are of two different spellings. Okay. The spelling is very important. Laterality is important. Left, right. Okay. Uh, for the skeletal system, we will be requiring you to state right or left for the long bones of the extremity. No? The right or left humerus, uh, radius ulna, and femur, tibia fibula, including patella. You should be able to determine whether it's right or left, unless it's stipulated that you may not, because usually there will be specific. So you have to be very specific. It should be right or left. But we're requiring that only for the long bones, including the scapula, no, and clavicle, because it is important that given the bone, you will be able to determine immediately and orient yourself. Uh, what is this bone? Oh, which side, left or right? Now, so what is important when you're given a structure? Always you orient yourself to the anatomical position of this one. Okay, given this structure is this. Am I looking at this an anterior? Am I looking at this in the posterior view? All right. So this is the left, this is the right, if there's a laterality. So those are the things that you need to determine. That is why when you're going also into the laboratory, do not be shy to ask around your classmates or your faculty, because that's the time to ask questions. Because you're learning, everybody's learning. Ask them, how do you determine is this right, is this left, etc. The important thing there is we are there to monitor you. If you have questions, you ask us. If you are not there physically, you can always uh, you know message us, text, or the Google chat box, or the Viber if you want immediate satisfaction of the answer. Imo Viber. Pwede na po. Questions?
Good morning, Doc. I just like to
Okay.
ask lang, Doc, regarding sa there's naka-state mag sa mo schedule, Doc, that we have like kanang zombie run. Like on ni siya? I think most of us are not familiar with this, magod, Doc.
Okay. I'm sorry, I did not give you the other name of the gallery run. That is the zombie run. zombie run is the gallery run, the one that I mentioned earlier, that you have a sort of a practical exam. Usually this is 10 stations. I think in your case, this will be 12 stations because you are six groups. We can afford to have 12 stations. And as a group, you'll be taking this as a practical exam. No? You'll go through each station, time limited per station. Okay. Again, in the past, we used to do this using PowerPoint. One PowerPoint slide per station. You're only given about 6 minutes per slide, and then you move on to the next station, no? And you discuss as a group uh, as regards to what you see and identify what you need to be identifying there, and then also you will try to you'll answer the questions posed in that station. But since we're already using uh, team-based TBL, the platform of Inti Dashboard. So it's not actually TBL, it's in Inti Dashboard already, meaning that your stations, you'll be uh, you'll be going through the stations through the Inti Dashboard. So instead of you given one station for just 6 minutes, the entire 12 minutes you need to allocate the whole, say, 12 minutes times 6, that should be what, 24, 48, 60 minutes, whole hour of uh, 1 hour for the 12 stations to go through it. You know? So you can you're able to go back and forth between stations. In the past, you cannot go back. So now you may go back. That was what happened last year. So you can go through. What is important is in this station, there should be a group participation. Everybody participates, speak their mind, uh, ask the questions, and then answer what is asked of you per station. Hopefully, Vince, I answered that. No? So I, I already touched on the zombie run or the gallery run earlier during the PowerPoint presentation I had. Vince,
Yes,
okay.
Doc. Thank you very much, Doc.
Any other question? Um, do we have any other one? Um, do you have any other inputs from the other faculty? Ako, nalimtan ninyo diha. Dob, Dr. Lucero,
Nana ako, Dok.
Dr. De Vera is here. Yay! Where is she? Asa man siya?
Wala ko mic. Okay na.
All right. Okay. So, may I ask you the grouping of A and B will be applied to? No, Queenie, you work on the zombie run as an entire group. It's not in a TBL subgroups. The grouping is not TBL, but it's as your SGD, TBL group. But the platform we're using is the Inti dashboard. Actually, it's not a team-based. It is a team-based learning activity. It is a TBL because the whole entire group is there. You discuss that. It is at the same time a graded, much like the team-based learning. You also have a pre-reading session. Pre-reading because you've been studying the bones for since last Friday supposedly until the day before of the zombie run. It's what you call the gallery walk. No? So these are your pre-readings already. So very similar to TBL. Okay. Yeah. The difference is you don't have an IRAT. There's no IRAT here. There's a TRAT. It just goes the, the, the entire team will have the same grade. Okay. But I think wait. Yeah, because your answers will be placed immediately in the Inti dashboard, so you will not be able to change that anymore. Although during the plenary session, if you think that over the period given to you to research and prepare for a presentation, you feel that your answer during the zombie run was wrong in one station, or particular answers in one station may naka-interchange, you may correct yourself when you present, but your answers during the zombie run remains the same, because you'll have a different grade for your zombie run, a different grade for your plenary, and a different grade for your manuscript. So, okay, right? So these are things that provide you so many opportunities to learn. So not just written lang, you can have all of this. But important is you work as a team. If you don't work as a team, you will always break down. Yes, no more questions? No more questions. Okay, so this afternoon,
Oh, Mike, basi gara mo lecture pas Joan, no?
Ayaw, Dok.
so this afternoon, okay, from now until 1 o'clock, you can have your lunch and prepare for your lunch. You read, the upper extremities. No? John, nakabutang naman ka sa pre-reading now sa Blue Link? Wala pa.
Ay,
Okay.
wala pa, Dok.
All right. You go through the website, the course site. Concentrate on the upper extremity. You read through the videos there. Watch the videos, not read. No? Hindi mo lang basahon. No? If you watch the videos and then you prepare for the 1 o'clock activity. I will open the laboratory activity by then, and then the folders will be open for a short period of time, and we will close it. Of course, if you are not able to upload it because time has lapsed, you inform us. You just message us. You can still submit, but we'll provide you another avenue to submit for that. Of course, if you remember, there's a rubric, there's a time frame. If you're able to submit it, so there's a factor that is taken away from your total points. For those of you who are not able to take a 1 or 2 lab activity, you just tell us. We will also create a new lab activity for you. Like Denise, no? Castilla. Is Denise here?
Yes, Dok.
Yes. Be patient. I'm still creating one for the ones that you have missed. No?
Dok, thank you.
Okay. Any questions? Think of this laboratory work as graded formative. They are formative. They are there to prepare you for the practical exams. Even the way you answer your lab questions. Okay. So it will be slightly different from the surface anatomy. This time, okay, it's slightly different. And I presume it will be fast. But you need to watch the videos. Any questions?
Share screen ako, Dok.
Yeah, Dr. Camelo.